Hi, I am Dr. Bimal Vadakut, working as specialist ophthalmologist in Naseem Medical Center, Al Wakra branch. Today I am going to talk something about silent killers of vision, killers of mainly adult vision. Those are glaucoma and diabetic retinopathy. The reason why we call them silent killers of vision is that the patient may not experience any problem in the initial phase of this glaucoma as well as this diabetic retinopathy, and once the patient starts to experience vision problems like disturbance of vision or field loss, the stage will be already set for the disease to progress. Actually, that's we cannot do much from that stage. So to keep those diseases at our control, it's very important to identify them at an earlier stage, this glaucoma as well as diabetic retinopathy. That's why they are called the silent killers of our vision. As the name suggests, diabetic retinopathy diabetic retinopathy affects people with diabetes, mainly the type 2 diabetes or type 1 diabetes. The main risk factors for developing diabetic retinopathy is the duration of diabetes. The longer the duration, the more chances for getting diabetic retinopathy. Other is inadequate control of diabetic status. Then comorbidities like hypertension, hypercholesterolemia, all these are smoking, all these are factors which can contribute to the development of diabetic retinopathy. As the name implies, diabetic retinopathy affect the retina of your eye. It can present as small hemorrhages, small exudates, and at the final stage it can result in tractional retinal detachment as well as vitreous hemorrhage, that is hemorrhage into the eye. Once the hemorrhage or tractional retinal detachment develops, the outcome is not that good. Even though there are many treatment like laser, intravitreal injection and vitrectomy treatment, the results are not that good. So it's very important to identify diabetic retinopathy at an early stage, so we can prevent with some simple laser, some diet modification, some medicines, etc. So all the diabetic patients should undergo periodical dilated eye examination by a good ophthalmologist, and we have got every facilities in our Naseem Medical Center to help you combat this diabetic retinopathy. So all the diabetic patients should undergo yearly diabetic retinopathy evaluation by an ophthalmologist, even though you are not experiencing any problem for your eye. Another silent killer is glaucoma. Who all are at risk for the glaucoma? And many patients thinks that glaucoma patients will develop eye pain. It's only a small percentage of glaucoma, mainly the angle closure glaucoma patients will experience eye pain. The majority of glaucoma patients will not experience any eye pain or loss of vision at the earliest stage. But once the glaucoma sets in, that sets by field loss or decreased vision, the treatment is very difficult, or actually it is impossible. So identify the glaucoma at an earlier stage. You should visit an ophthalmologist to check for the disc cupping and intraocular pressure, eye pressure. Just like body pressure, our eye has got pressure. If the eye pressure is high, the chance for getting glaucoma is higher. Glaucoma is optic nerve change. So any optic nerve change or raised intraocular pressure or any field loss, it should be checked by an ophthalmologist. And in our Naseem Medical Center, we have got every equipment to say that you don't have glaucoma or you have glaucoma something. Then who should undergo the screening for glaucoma? Any patients with family history of glaucoma. Family history of glaucoma means father, mother or immediate cousins or grandparents having glaucoma, and the patient crosses the age 30 or 40, he or she should undergo screening for glaucoma. And all diabetic patients after the age of 30 or 35 should undergo screening for glaucoma, because diabetic patients can develop diabetic retinopathy as well as glaucoma. So all the diabetic patients should undergo screening for diabetic retinopathy as well as glaucoma, diabetes patients. Then myopic patients after the age of 40 is at increased risk for developing glaucoma. So all the myope patients should undergo screening for glaucoma. So in nutshell, I will say all the diabetic patients after the age of maybe Previously we used to tell after the age of 40, but I will tell all the diabetic patients after the age of 30 should undergo 2 screening, that is diabetic retinopathy screening and glaucoma screening, and all the individuals with the family history of glaucoma or myopic patients after the age of 40 should undergo glaucoma evaluation by an experienced ophthalmologist. And we at Naseem Medical Center are provided with fully equipped to diagnose and treat your diabetic retinopathy as well as glaucoma. So, do not hesitate to check your eyes for these 2 silent killers of vision like glaucoma as well as diabetic retinopathy, and we are here to help you out. Thank you.